All right, thanks, Kate. We are so excited about our new interactive resource. It includes strategy guides and resource lists. There's links to toolkits and all kinds of other materials. What I love about it is it's really easy to navigate. You can just click on the arrows to get to the section that you're most interested in. And so, as Kate said earlier, we really, for this time today, are drawing on what is included in this resource as far as action planning and getting to know a little bit about some of the different chronic conditions. And so, we really encourage you to go and check it out. I'm curious if anyone has already taken a look at it. We released it not too long ago, but we did share it at the National After School Association convention and in a couple other places. So if you have seen it, if you want to drop an emoji in the chat or you want to tell us a little bit about what you thought of it, if you've had a chance to check it out. And we're going to talk in this section about tools and resources. We wanted to really be able to provide you with some actionable things that you could leave with, that you would then have access to. So, starting with identification, supporting youth with chronic conditions really starts with identification. And the key is to identify them early, if possible, as we just heard. And so, doing that during enrollment, setting up a time that you can be having some initial interactions with parents as you're doing intake, or you set up a family interview with them, conversations with youth and with families at that intake, but as someone I shared in the chat, but also ongoing so that if something new emerges, if something changes, you want to really set up this environment where youth and parents will feel that they can trust you, they will feel comfortable so that if they have new or additional information, or maybe something that wasn't caught or shared right at intake, they're going to feel comfortable to come to you, come to your staff, and share that. And so, again, there's lots of different times and ways that you can do this. We're sharing here an example of an individual plan that would be filled out at intake that I found with the link. It's from Medfield's after school program here. One of the things I really like about this is they actually also specifically ask for parents to attach a copy if there's already an existing health plan or action plan. Maybe they have one at school and the parent has a copy of it. And so they are able to share it directly because it's their child's information. Then that's a great jumping off point for you to start with. Once you've identified that you have a chronic condition, it's really important, as we've heard, to have a plan. And a place to start with that is with action plans. And the good news is that there are a lot of examples and a lot of existing templates that you can draw from. We're going to take a look at a few examples today for some of the most common conditions is that Kate mentioned that we find for youth. And I'm gonna just click onto our, and so each one that we go through and this is actually a screenshot taken directly from the guide. So this is what the guide looks like inside. And you'll see for each chronic health condition, there is an associated or linked action plan that you can go and take a look at. And so for asthma, that link is going to take you to this example action plan, which actually in this case covers asthma and allergies. One thing I really like about this particular plan, about most action plan templates that you're going to look at, is it not only has information about daily management for this condition, but then also what the response should be in an emergency. So we're going to just take a quick look at some of the other conditions that are covered in the toolkit, as well as some examples of plans that you can find to go with those. So, for example, our scenario that we looked at was around allergic reactions, and there are action plans that exist for that again allow you to think about what might we need to be doing daily? Are there things in the environment we should look for? Are there early warning signs? Are there things that help this student to manage to not have an allergic reaction or to manage those on a daily basis for themselves? And then if there is an exposure or there is a reaction, what are the things that staff need to be able to do to handle that reaction, to determine what actions to take next? somebody shared in the chat when we were talking about the scenarios about some of the benefits of calling 911 and really made some great points there about if you're in doubt, they can provide you with an opinion about whether this is an emergency or not. They're able to assess the child, but there may also be situations in which calling 911 isn't the thing that should be done first. I had a child that had seizures. That was a diagnosed condition for him, and so part of his plan was that if it lasted less than 5 minutes, he just needed a place to rest. There weren't, we didn't need to call the ambulance. But that was for my particular child and was a plan that we worked through together as a parent and with his healthcare provider and with the school and with the after school program that he was in. So it was very clearly laid out what to look for and what to do in an emergency. And so all of these action plans are going to help cover that, how to manage them daily and then how to manage in an emergency. I wanted to show you this one for diabetes in particular. This one is so comprehensive because I think when you have a child who's diabetic, often there's a lot of things to be considering. And so this one is like 6 pages long. I didn't want to put the whole thing on here and have it feel overwhelming, but it's actually really well organized and gives you places to list medications and supplies, how to plan daily, how to plan if something happens. They also talk about how to plan for things like field trips or unusual events, which can be really helpful. And so just wanted to draw your attention to that. And then there's also a page in there for seizure disorders. And again, this is similar to what we created for my child of, here's kind of the usual plan, here's an emergency plan. We've also linked here, and you'll see when you check out the toolkit, the Epilepsy Foundation not only has examples of these plans, but they also have a variety of tools that you can share, tips for how to observe and time seizures, things like that. And so if you have children in your program that have a seizure disorder, this is something that you may want to check out. So great. You now have these action plans, right? So you've got someone who's diabetic and you've got their action plan, and you've got someone who's got allergies and you've got their action plan. What do you do with them? And so what we suggest is creating a centralized resource. And so that could literally be a binder where all these things live. But maybe, it's been a while since I've worked in that particular setting or been a parent of a child in that setting. So maybe there's an electronic platform where these exist instead, or you found a way for your program to house this in some way that is accessible by staff so they have access to it and they are familiar with it, but also protects that youth's confidentiality, keeps their information private.